Let's be real, finding a lump is terrifying. And what happens next, that whole medical journey, can feel like a total mystery. So today, we're going to demystify it. We are going to walk through the entire diagnostic path for testicular cancer, step by step, so you know exactly what to expect. So, it all starts in that one moment, right? You find something that just doesn't feel right. This question right here is the one that hits you immediately, and it's the exact journey we're about to take together. We'll go from that very first sign all the way to a definitive answer. Okay, so every journey has a beginning, and for testicular cancer, it starts with noticing those very first signs. So what are you actually looking for? What are the key symptoms that should make you pick up the phone and call a doctor? Now, this is probably the most important and maybe the most misleading thing to know. The most common sign is typically a painless lump or some kind of hardening. And that's a really critical point, you know? Our brains are basically wired to think pain equals a problem. So when there's no pain, it can give you this false sense of security. And that can lead to really dangerous delays in getting checked out. But of course, that painless rule isn't set in stone. In about 10 to 20% of cases, there is some kind of dull pain or an ache. And this can actually muddy the waters a bit, making it really easy to mistake for something more common, something less serious like an infection. The bottom line is this: painful or not, any new lump or any change at all needs a professional opinion. Period. All right, you've done the right thing. You've found something and you've made that appointment. You're sitting in the doctor's office. What happens now? Let's break down what that first physical exam is actually like. Get ready for this number because it's a big one. A whopping 85% of these tumors are first found simply by touch, through a physical palpation. This isn't about some fancy, complicated machine. It's about a hands-on exam. And that's just powerful proof of how incredibly critical both a doctor's exam and your own self-exams really are. So what exactly is the doctor doing? Well, first, they'll use both hands, that's the bimanual part, to very carefully feel and compare both testicles. They're checking for any differences in size, surface, or consistency. But the exam doesn't stop there. They'll also check lymph nodes way up by the collarbone, because that's a potential place for cancer to spread. And finally, they'll check for any breast enlargement, which is a rare but pretty significant sign that can be caused by hormone changes from a tumor. Okay, the physical exam is done. Now it's time to actually see what's going on inside. And the go-to method for this is a high-resolution ultrasound. It's totally non-invasive and super effective at getting a clear picture of the tissue. So what are they looking for on that ultrasound screen? Well, think of it like this. Healthy tissue looks smooth, consistent, uniform. But a tumor just messes that pattern all up. It usually shows up as a darker area, they call it hypoechogenic, and it has a much more chaotic, uneven texture. That big visual difference is a huge clue for the doctors. So we've got the physical exam, we've got the ultrasound, but that's not the whole story. The next piece of the puzzle is a blood test. Doctors are looking for specific proteins called serum tumor markers, and these can give them even more evidence and help them start figuring out what type of tumor it might be. But here's a really, really important thing to understand about these blood tests. They're useful, for sure, but they are not foolproof. About 2/3 of tumors will produce these markers, which means a whole third of these tumors, they fly completely under the radar on this test. And that's a vital piece of the puzzle to remember. So the two main markers they're looking for are called AFP and beta-HCG. And the big difference between them is where they come from. AFP is only made by one of the major tumor types, called a non-seminoma. But beta-HCG, that can be produced by both major types, seminomas and non-seminomas. This little difference is actually a huge clue for doctors. It gives them their first hint about what they might be dealing with, long before they can confirm it with surgery. And this all circles back to that 1/3 of cases we were just talking about. The source material is crystal clear on this, and it's maybe the single most important thing to know about the blood tests. Having negative marker levels does not rule out cancer. A clean blood test is great news for sure, but it is not a definitive all clear. Okay, let's recap. We've got the physical exam, the ultrasound, the blood tests. All the evidence is starting to point in one direction. So what happens now to get that final 100% confirmation and figure out a game plan? The only way to know for sure what's going on is through surgery. The procedure is called an inguinal orchiectomy. Basically, it means removing the testicle through a small incision up in the groin area. And this step is so critical because it does two things at once.
A pathologist can analyze the tissue to get a 100% certain diagnosis, and at the same time, it's the main treatment because it removes the tumor itself.
So, the surgery is done. The tumor is confirmed. But the journey isn't quite over. The next step is called staging. This just means using CT or MRI scans to get a full picture of the body to see if the cancer has spread anywhere else. Finally, all the pieces of information, the lab report from the tumor, the blood marker levels, the imaging scans, they're all brought together. This complete picture determines the cancer's stage and is used to build the exact right treatment plan moving forward. So, there you have it. We've gone from that first moment of discovery all the way through the entire clinical journey. But, as we saw with a staggering 85% of tumors being found just by feel, the most critical step of all is the one that happens before you even see a doctor. So, the question that ends this whole thing is a simple one. The very first step in this entire journey starts with you. Are you checking?